You know, psoriasis is a medical condition that can happen to anyone, and we've got all details on how to keep you informed right now and what you could possibly do if you know somebody or it's you that suffers from this condition with Bobby Huang. He is a psoriasis patient. Hello, Bobby.
Yes, hello, Dylan. Thank you for having me.
Good to have you here. We'll get people informed on this, on the myths and what people can do. What is psoriasis exactly?
Sure, yes. So psoriasis is an autoimmune condition that comes from the inside. You're born with it, and it can be triggered by stress, by certain environmental factors, but it's a very serious condition that affects over 1 million Canadians and over 125 million people worldwide.
Okay. So what are the symptoms? What happens when a flare-up happens?
There'll be lesions that it basically becomes an overproduction of skin cells, and it becomes, you swell up, it becomes itchy, there's scaling, there's, you become really self-conscious about how you look. It can look like it's just like dandruff, it can look like there's something like that's on your skin that feels like an allergy.
Okay.
But it's one of those conditions I think is very misunderstood, and it's a difficult topic to discuss because it's something that's on your skin that people can see all the time.
Okay, and there's lots of myths as well. So what are some of the myths that people, when they hear the word psoriasis, they think this and it's wrong?
Absolutely. Some of the myths that I've encountered through my time having been diagnosed with this condition is just that it's a hygiene issue, or you just have to moisturize, it'll go away, or as Kim Kardashian had a small patch and people thought, oh, it's a minor issue, it's just a skin rash. It's beyond that, and if left untreated, it can lead to very serious health effects.
Such as?
Such as heart attacks, hypertension.
Wow, real serious. Okay, so let's talk about your story. So
Sure.
when were you, is diagnosed the correct word?
Yes, that's correct.
Okay, so when did this all go down for you?
Yes, I was diagnosed 10 years ago in my early 20s, but it had been a condition that I'd been coping with managing since high school, and that's obviously a very sensitive time for a lot of people, where you're trying to fit in, you're trying not to feel like you're an outsider. So that was a time where you're self-conscious about your growing, your hormones, everything, you know, everything's changing for you. So when you have this condition, it can be very difficult to feel confident and want to go out and just be social.
Yeah. So you undertook some treatment that has been very successful. So what exactly was the treatment?
Yes, so I'm currently on a biologic where it's an injection that I take once a month that manages symptoms, so it works on the immune system, because it's a condition that manifests from the inside. It's a misfiring immune system, essentially. So this injection that I take helps to realign my immune system to kind of keep it in kind of layman's terms here.
Okay, so give us some tips then for people who are dealing with psoriasis.
Well, I think first of all, it's really important to talk about it and not to want to just hide and just not see people, because for a long time that was my situation where I just wanted to run away and hide. And the fact is, there's a lot of people who struggle with this condition, including celebrities like Cyndi Lauper and as I was referencing earlier, Kim Kardashian.
Yeah.
And it manifests at different degrees, so it's important that you seek medical help. So using the best time with your dermatologist? Exactly.
Asking questions?
Come in with a plan, know what your goals are and what you're satisfied with.
Okay. So at this point, patients are demanding better treatment?
And absolutely. I think there's a lot of different treatments out there, but there's a lot of also barriers to the treatments in terms of cost, insurance coverage, and especially if you live in northern rural communities where there may not be as many dermatologists or medical professionals to begin with.
Okay, so for someone who does not suffer from psoriasis, what could they do to help out people like yourself? Well,
I think it's important to just increase their awareness and understand that psoriasis is not contagious, but education and awareness is. So I encourage people to download the report card on psoriasis and its effects on people's quality of life.
Okay.
It's psoserious.ca. And they've just released a report on how many people are affected by this condition.
Okay, and lots of people are.
Absolutely.
Okay. Bobby, thank you very much for telling your story here today and informing us.
Great.
Appreciate
Thank you,
your time.
Dylan.
And thank you for being here as always. I'm Dylan Black. Have yourself a good day. This is Rogers TV.